Hey everyone, I'm Brittany Skyler, and today is Tuesday, June 10th. You're now watching Open, a program that brings the Bronx and New York City straight to you. Don't forget to stay connected with us via social media at BronxNet TV. Dr. Kenneth Serrano grew up in the Bronx with deep connections to the community. He remembers the obstacles his grandmother faced trying to navigate the healthcare system after she arrived from Puerto Rico. This was part of his drive to become a doctor. As part of Mental Health Awareness Month, he and his colleagues are giving talks in the community centers across the Bronx. Dr. Kenneth, thank you for joining us.
Good morning. Thank you for having me.
Good morning. So to start things off, tell us about your upbringing in the Bronx. Everybody has a different story. So tell us, what was it like growing up for you in the Bronx?
Mhm. My family has been in the Bronx now for generations. On one side, my great grandparents came here, and on the other side, my grandparents came here. Um, they've lived in the Bronx, been raised in the Bronx. Same thing for my parents. I was born in Morris Park and went to elementary school in Pelham Bay, where my grandma lived. And I have a lot of fond memories growing up in the Bronx. I spent a lot of time at Pelham Bay Park, Whitestone Cinemas when it was around, Yankees games, Arthur Ave, Louis and Ernie's, you name it. I would just say, like, on the other hand, it's pretty clear, even as a child, that the community is underserved in a lot of ways.
Yeah, absolutely. You did mention all the Bronx spots that we love, but like you did mention, the community is underserved. So when your grandmother came here from Puerto Rico, she did struggle navigating the healthcare system, which in turn shaped your drive to become a doctor. So can you tell us a little bit about that?
Sure. Um, yeah, I remember hearing from my grandma conversations with other family members, and I vividly remember her talking about how she would go to see a doctor, which in itself it was difficult finding a doctor. But when she was able to find one, she didn't have the best experiences. She would often come more confused after the doctor's appointment because she got a lot of information that wasn't really, really explained to her. So, and when these things sound more like lectures, it makes people generally less interested in their health. It's really important to be have it be a give and take so people can learn more about their health and you can earn their trust.
100%. I hear a lot of times that people do kind of stay away from the doctor because, like you said, it becomes a lecture and it almost becomes like this scolding in a sense. So it's like,
Hmm.
why am I going to go back? But throughout your medical career, you did end up choosing psychiatry. Can you tell us a little bit about why?
Sure. um, I would say when I was younger, I didn't have a ton of experience with the mental health care system. There were some family members, and of course other people in the community, so I had a pretty limited understanding of what exactly the field entailed.
Hmm.
When I went to med school, I actually planned on doing either pediatrics or radiology, because those are the best experiences I had with doctors, like during college at least. Um, and then COVID happened. And when COVID happened, I spent a lot of time reading really everything medical related. And I found myself really drawn to a lot of things about psychiatry specifically. I always tell people that I consider it a very wide and a very deep field. Wide in the sense that it has overlap with really everything: sociology, law, ethics, you name it. But it's also very deep. There's a lot of ways that you can grow. There's so much to learn, and and at its core, it's a privilege to be able to speak with people about their lives and earn their trust.
Yeah, absolutely. And so, with that, you're now training at Montefiore. What is
Mhm.
it like to be back in your home borough studying medicine and serving the community?
It's really meaningful, and it makes the work even more meaningful than it already is, and it really is a big motivator. When I was a kid, Montefiore was the healthcare system in the Bronx. Um, and as a kid, to me, it was the medical school, the hospital, and like it's where I wanted to be. And like how lucky can one be, achieving their dreams essentially. So I'm very happy to be here and I love the job. It is a difficult job, I will say, and it can be really draining at times, but just being able to do the job day to day, talk about people with their lives and hopefully get to help them in some way is really like I cannot take it for granted.
That's amazing. I think there's something so special about serving the community that once served you. And so,
Mhm.
in that, you did mention that the Bronx is an underserved community, which we've seen time and time again. So, can you tell me what are some of the unique mental health challenges that patients here in the Bronx face?
Mhm. Yeah, so the first thing that comes to mind, I would say, at least from my experience of seeing patients in various different settings at this point, it's pretty clear that there's a significant trauma history with a lot of patients in the community. Um, be it from their family or just like the barriers of society, essentially. One of those barriers being access to mental health care at all. Um, y- there isn't access to some more like specialized sort of programs and what have you that might be in other wealthier areas. So we're kind of, doing what we can with what we have. Um, there's a lot of immigrant communities which we try and serve best we can, but there is a language barrier. And even when using interpreters, some things might be lost in communication. Um, I think we have a very strong and resilient community, but there are a lot of challenges that we need to face every day.
Absolutely. Now tell me, is there anything that you pull from your personal experience to then, be able to serve your patients and serve the people of the Bronx?
Mhm. I would say for me, when I was a kid, I remember seeing my pediatrician and feeling very comfortable with them and feeling like they want to listen to me. And that's something that is really important to me when I'm seeing patients. A lot of the time it's their first introduction to healthcare or mental health care or the emergency room. So it's really important to set a good first impression so they can feel comfortable. Because a lot of the questions we end up asking people, they're pretty tough questions. And you need to be able to make them feel comfortable and safe.
Yeah, absolutely. And you kind of just touched on that is providing this welcoming care. So in a mental health setting, again, can you elaborate on what does that mean to you specifically?
Mhm. I would say to me, the first thing I think of is sort of the give and take that I was talking about, right?
Hmm.
Because the patient, you're learning so much about them, you're asking all these questions, and you don't want to make it seem as though their input isn't appreciated, because really the relationship is more of a collaboration than anything. Every patient has their own unique story, and a good psychiatrist, not only needs to listen, but needs to get the patient's input and see what works for them. And I think that's the way forward to really help people.
Yeah, of course. And for Mental Health Awareness Month, you and your colleagues are giving talks to the community. Can you tell us a little bit about what that entails?
Sure. Yeah, it's been a really good experience. A lot of residents in the program end up doing it, going to different places to do so. For me in particular, I've only done them at senior centers. The presentations end up being basically initially about a topic, but it tends to
Mhm.
become more of a Q&A. A lot of people are unfamiliar with the healthcare system, the mental health care system, the options available to them, and just even descriptions of the things that they're dealing with. Um, so sometimes you kind of get some questions out of left field, but those those are helping you connect this person to care and help them live a better life. Even senior centers, like there's a big need there as well. So it's been a really good experience.
That's amazing to hear. And of course, another really, really great way to give back. So at the end of these talks, what do you hope that residents take away from hearing you?
Mhm. I hope that residents take away the fact that we need to learn from our patients
Hmm.
and meet them where they're at. Um, it's very easy to tell somebody this is what you need to do, this is where you need to go, but there's more to it than that. And I think that those are the sorts of things that we should focus on. Of course, as a psychiatrist, we can use medications, we can use therapy and whatnot. But the things that tend to work are the things that the patient, wants and will do.
Yeah, absolutely. And something that I do want to touch on is somebody, I'm Puerto Rican myself, and a lot of times in these Latino communities, I'd say seeing a psychiatrist or, getting help in a way is almost frowned upon, right? It's something that's not talked about, something that mental health really isn't discussed in these communities, or at least when I was growing up. So, do you oftentimes find people who might be closed off because of this?
Definitely.
Hmm.
Which leads to kind of what I was saying about the first impression. Um, you need to be able to make someone feel comfortable and safe in order
Hmm.
to ask these questions. But a lot of the time, we don't always get, exactly what's on their mind, and
Hmm.
and that's okay. People need to be able to open up at their own pace. I would say similarly, I have experience having a lot of patients from a similar background whose family didn't really want to discuss the issue or maybe even kind of ignored the issue. So we need to give them some sort of space to be able to talk about those things. I think if we're able to reach people one at a time, this stigma that we're facing will slowly fade.
Absolutely. Thank you for sharing that. And just as we wrap up, can you tell us what is your vision for the future of mental health here in the Bronx?
Mhm. I think my vision for the future of mental health care in the Bronx is expanding access to the community. Um, you know, I feel like the people of the Bronx deserve more resources and deserve the programs that, like, you shouldn't be limited in what you have access to based on like the zip code that you're born in, right? So my goal is to be able to have some of these things that the community needs. I think Montefiore is doing well in this regard. We're opening up a new child unit, a new emergency room. So slowly, we're helping with that lack of access. But I think in the future, the goal is to really kind of erase that barrier. And I would also, the asterisk I would put there as well is earlier I was talking about the trauma history of a lot of our patients. I think it's important for our system, our mental health care system, to really address those things. It can be hard to find people that specialize in that. So I would like that to be expanded.
Absolutely. Dr. Serrano, thank you so much again for sitting down with us this morning.
Thanks so much.
For our viewers at home who may need help or know someone who needs this kind of support, please visit the website on the screen below. Don't go away, we'll be back with more Open after this.